Well, there's not a good early screening or early detection of ovarian cancer. We've tried with different methods, with ultrasound and certain tumor markers, but the studies that we've done till today, and it's been several studies here and abroad, seems like the screening methods or the early detection methods does not work very well. So the problem is women are being diagnosed late, and because of that, they are in advanced stage, and there's more mortality and morbidity in later stage. If we were able to detect it earlier, the survival will be better. So in earlier stages, the survival is about 95% in 5 years. When you go to later stage, that survival decreases to around 40-50% in 5 years. So there's a big difference. So of course, there's a need to diagnose this disease earlier, so it would be more survival. Well, so far, as I said, the methods that we've done with ultrasound and CT scan are not that precise, not accurate. With this, and also the same thing happens with tumor markers. With specifically this paper, what we're doing is trying to detect DNA in the blood of the patient that could be methylated, and we've done a kind of a selection of those DNA methylated probes, and we found several that could be very accurate to diagnose ovarian cancer. The machine learning that we use is to select, because initially we use a chip. There was a chip with 850,000 different probes for methylation in DNA. With all this machine learning and process, we decreases to 9 probes that could be effective. Now, this is all in a pilot study, right? Further studies are needed to validate if this can be done in a clinical setting. Well, so far we've done just in surgical specimens to see if we can differentiate in between cancer or not. Now we have to put it in practice in the blood, right? We know that there's DNA in blood coming from the tumors, and we know that DNA can be methylated. So we need to know if in blood this we can detect these probes that are methylated, and if we can detect it, they keep their accuracy to diagnose cancer or not. In fact, we just submitted a project with Mayo Clinic to further this study, to go that next step. Once we got that step, knowing that in blood we can detect these probes and also can be useful, then it would be doing in a high volume, in a screening setting, right? With a lot of people with and without cancer, because that's the only way to know if it's going to be an accurate and valid for early detection. Well, one of this is once we have these products. So with this, basically we create the model with the AI, but then the model itself is very simple. It's just an analysis that detects the cancer or not. With imaging models like we've been trying to develop too. It's a little more complicated, but the idea is to put a finalized model in a web so anybody can upload, for example, an ultrasound, a CT scan, and it will give a certain risk of cancer or not, right? You have 1% risk, you have 90% and everything in between, right, of having cancer. That's how we will apply clinically.